So for this video, I'm going to go over some abbreviations you're going to see on the MPJE. So it's important to know all of these. I would listen to this daily or make your own, find a Quizlet, make something to go over these daily. So we have, and these are in ABC order. These are my personal list of things that I think are important. You have AAC, actual acquisition cost, actual price pharmacists pay when purchasing units of a drug product. Usual price is discounted compared to the average wholesale price, AWP. You have the AMP, average manufacturer price, average price paid by wholesalers to a manufacturer for drugs that are to be sold at retail. And then you have the AWP, average wholesale price. Published wholesale price for a drug product can be used as the basis for pricing prescription drugs. When I skipped the ANDA, abbreviated new drug application, ANDA. Your CDC, Centers for Disease Control. CDER, Center for Drug Evaluation and Research. CFR, Code of Federal Regulations. It's a compilation of final regulations and notices promulgated for the federal government. Published annually by the U.S. Government Printing Office. First published in the Federal Register, a daily publication. The CMS, Centers for Medicare and Medicaid Services. This involves your patient counseling laws. Responsible for administering Medicare and overseeing states' administration of Medicaid. Used to be called the HCFA, Healthcare Financing Administration. Your CPSC, Consumer Product Safety Commission. This is who is in charge of the PPPA, Poison Prevention Packaging Act. Your CSOS, Controlled Substance Ordering System. This is an electronic substitute for DA Form 222 when ordering Schedules 1 and 2 substances. It also orders other controlled substances. The CSOS. DEA, Drug Enforcement Administration. Administration responsible for the Federal Controlled Substance Act, CSA. It is part of the U.S. Department of Justice. Your DHHS, or also known as HHS, Department of Health and Human Services. So under the HHS umbrella is the FDA, CMS, CDC, your National Institute of Health, NIH, and Health Resource and Service Administration, HRSA. The DME, that stands for Durable Medical Equipment, which is equipment that can stand repeated use, primarily used for medical purposes, is appropriate for the use in the home. Wheelchairs, oxygen tanks, walkers. Now your DUR, Drug Utilization Review, review of prescription drugs use, prescribing patterns. Its purpose is to determine if appropriate drugs are being prescribed and if those drugs are being used appropriately. Your EAC is Estimated Acquisition Costs, an estimated cost of a drug to a pharmacy based upon information collected by the HHS. Such costs are often based upon the quantity purchased. Your EHR, Electronic Health Records, which DHHS requirements to encourage health professionals to share clinical information. So EHR. FDA, Food and Drug Administration. FDCA, Food, Drug, and Cosmetics Act. Your FTC, this is the Federal Trade Commission. It's responsible for investigating unfair business practices, including misleading advertising, your misbranding. And this is for the non-controlled, I believe, drugs. GMP, that's your Good Manufacturing Practice. HIPAA, HIPAA, Health Insurance Portability and Accountability Act. Your HP, Homeopathic Pharmacopoeia of the United States, so HPUS also, HPUS. IND, Investigational New Drug. NABP, National Association of Boards of Pharmacy, which creates your NAPLEX and your MPJE. Your NDA, New Drug Application. NDC, National Drug Code, classification system for identifying specific drug products, used nationally for reimbursement and for identification of drug products. The NPI, National Provider Identifier. OTC, Over-the-Counter, also known as non-prescription. PBM, Pharmacy Benefit Managers, organizations that manage pharmaceutical benefits for managed care organizations or employers. Your PI is your package insert. Your PPI is your patient package insert. The REMS, REMS, Risk Evaluation and Mitigation Strategy. FDA requirement for drug manufacturers to develop strategies to assure safe use of a specific drug. SNDA, Supplemental New Drug Application. There's also the SDA, specialty denatured alcohol, but your SNDA, more important, supplemental new drug application. SNF, skilled nursing facility. It's a site that treats patients especially in need of rehabilitation or a lower level of medical care than is needed in a hospital. Your TRP, tamper-resistant packaging. The USP-NF, so USP/NF, United States Pharmacopedia, or your National Formulary, as it's also known. And this one, probably not as important, but just in case, your VIPPS, Verified Internet Pharmacy Practice Site. It's a list of relatively safe online pharmacies. So every time you read something, I suggest going to the back and looking through the abbreviations, and as soon as you see abbreviation you don't know, looking it up, and if you don't know for a second time, writing it down. That way you don't just go totally blank when you see something on the MPJE.